to start our review, but before we start, can you put your name and professor in the chat so everybody gets credit? Oh, I don't know why I don't have my video on, sorry. So everybody gets credit for being here. So we're gonna do a review. This is for exam number 2. So name and professor in the chat is great. And are there any questions before we start? No? Okay. I just want to check and see if I have, yeah, here it is. Okay. So what I do for my reviews is I always record them. I will share them with your professors, and I do a PowerPoint so you guys can follow along. I cannot share the PowerPoint with you, but you certainly can watch it as we go through it. And then on my recording, you can watch it again. Okay. So it'll be 50 questions like last time. We're going to have select all that apply as usual. Let's see here. Let's share my screen. All right. So the first thing we look at is our review the consequences of poverty in rural areas. We know that we see poverty in rural areas. And so when we take a look at reviewing our consequences, our groups at highest risk are going to be our kids, our minorities, racial and ethnic groups, and single parent families, particularly those headed by a woman. Among racial minority groups, we have our Hispanic group, which is increased the most. We know that in our rural communities, we have lower education. So what does that do to unemployment? If we have lower education, what do you think that does for unemployment?
Increases it.
Yeah, of course, increases it. The less the education, the higher the poverty. We know that with our health disparities. We know that when we're looking at our rural communities, we worry about their musculoskeletal. They're bent over all the time. I'm going to shrink us. They're bent over all the time, so they're harvesting crops. So we look at back and neck pain. As you can see here, think of the pictures as we go through this. So a nurse assesses their pain, and if it's aggravated with things such as bending, lifting, coughing, right? And we know sciatica is consistent with our herniated discs. Healthcare risks for clients who don't seek care. We know that rural communities are less likely to participate in activities. They have a decreased compliance with safety, such as seat belts. Chronic disease, we know, is much more prevalent among our rural community. And we know that they don't like to share a lot of stuff because everybody knows everybody, right? So they're less likely to report their sexual assault, drug abuse, and depression, any mental illnesses. When we look at our primary, secondary, and tertiary with pesticides, so primary intervention is going to be provide education. We always think of primary and educating. We're going to provide hand washing stations and conduct screening, such as urine testing for pesticides with our secondary. And we're going to do treatments for those symptoms we see, such as nausea, vomiting, and skin irritation. This is a repeat for you, but just to remind yourselves that you're going to have higher chronic disease in our rural clients. When we take a look at our Mexican culture, we know that the nurse is considered an authority figure. We like them to relate. This was on our last test. Some chit chat before we find out about their problems. Fastest growing population among our homeless is going to be our families with kids. Single motherhood is increasing. We see a direct relationship between the lack of education and poverty. Poor teens are 3 times more likely to drop out of school. What we want to make sure we do is keep those pregnant teens in school. Why? Why do we not keep our pregnant teens in school? Nobody knows. Remember our relationship with education and poverty. So we want to keep them educated so that their chances of poverty are much less. Healthcare to our homeless, we know we have the same problems accessing care. We do crisis oriented. We go to the ERs. Homeless adolescents living on the streets, we know have greater risk behaviors such as early onset of sexual activity, more susceptible to things like hepatitis. We see more use of alcohol and drugs among our homeless teens. With our vulnerable populations in HIV, we know HIV is transmitted by sexual contact and bodily fluids. Those who are in high risk for HIV are IV drug users, persistent and recurrent STDs, and those who have multiple sex partners. When we're looking at our youth, what we're trying to do is create activities that help with social skills to decrease the violence among our teens. So we want to make sure that our goal is to create good social skills so we see less violence. Primary prevention, what do we know about mixing drugs and alcohol?
That you shouldn't.
Yeah, exactly, that you shouldn't. And we know that when we have meds that depress the central nervous system, we don't want to mix them with alcohol because it'll completely depress it, right? Risk factors for chronic use, we're going to have violence, trauma, genetic connections, and our mental illness. Healthy People 2030, we were talking about tobacco and how we're going to work with that. Provide community education to teach healthy lifestyles, institute early detection programs in schools, drug screenings, risk survey, that's a big one. And tertiary, develop programs to help people reduce or end their substance abuse. We know vape oils are poisonous. So if someone says, oh, I don't worry about my vape, we need to share with them that they're poisonous to children. We have two different types of parish nursing. We have congregational, which focuses on a specific congregation, and we have institutional, which acts as a leeway between the church and the outside entities. Okay, so we get the community involved there. Some primary preventions may see with a parish nurse: whole classes on healthy eating, variety of activities. Secondary, we're going to do some weight screenings, and tertiary, we're going to look at like weight reduction support groups. Important for our care plans and nursing process, when we steer the conversation towards goals, we want to make sure the client mutually identifies our outcome. Health problems and limitations we see as part of the assessment, which allows us to form a nursing diagnosis. Medicare and Medicaid coverage, please know that our Medicare, it's going to be our 65 and older for the most part. We're going to have them doing nursing services only. We're not going to have those non-nursing services. Medicaid is based on a lack of financial resources, federal and state programmed. Medicare will only pay, as we said, for skilled professionals when homebound. What's our primary goal of hospice care? We're going to have quality care and comfort. That's what we're giving to our patients, and dignity. Federal agencies that help with community nursing. We have the World Health Organization. We have OSHA, remember, Occupational Safety and Health, and Agency for Research and Quality. This week, we look at epidemiology. Remember, it's the study of why do things happen in a certain population and how can we use that to control things. We have analytical, which is going to look at our causes, like why did some get it and some not? Think about COVID and how some people got it and some people didn't. We have our epidemiological triangle, which is very important. Our host, our environment, and our agent. We know our disease is produced by exposure of a susceptible host to an agent in the presence of environmental factors. So we look at some things for our agents. We'll have bacteria, alcohol, trauma. Our host is, we're going to look at the age, the sex, the gender, genetic profiles, previous diseases, immune status, which is important, occupations. And then our environment, is it crowded? Is the water good? Is there something going around in the community? For environmental health, we had Healthy People 2030, increase the proportion of work sites that offer a health promotion, physical activity program, Work sites that offer a nutrition program, reduce deaths from work-related. We know that for environmental health, our individuals with our immune compromise are going to have higher risk after contaminated food and water because their immune system isn't able to tolerate it as well. So here's just a little picture of how the environment impacts our health. We have air pollution, sanitation, chemicals, radiation, noise, agricultural, and climate change. Case fatality rate, please know the definition for this. It's the proportion of persons diagnosed with a particular disorder. And so oftentimes people will say, you know, what's my case fatality rate? It's what's my chances really? When we look at environmental health, we're going to look at those safe drinking regulations, promote health and safety, and reduce our unhealthy air quality. We'll take a look at the different types of studies, and this goes with our ecological studies. We have our ecological, which is our easiest or fastest. What we do with this is we look at rates. We don't really do a whole lot other than that. So we're going to look at like population rates of big groups to try to come up with some things we need to investigate or some new hypotheses that we study. Then we have our cross-sectional, and so we have a population, and it's going to be as cross-section, and we're going to have information collected on like things like health status, personal characteristics, risk factors, and there's always a simultaneous collection of information, okay, to see is this exposure causing a disease. Retrospective is, if we think of the word retro, that means before. So in these studies, we look at things that have already happened. So existing records, hospital records, and then what have they been exposed to and how has the cohort followed this over time. We talked about occupational nursing this week, and that's our specialty care that promotes on preventative healthcare promotion and health restoration in a safe environment in the workforce. We see it in manufacturing, industry, healthcare, construction, and government all around. And my reference was the book. Okay, I'm going to stop sharing at this point. What kind of questions do we have? Did everybody put their name and professor in the chat? Yeah, okay, good. What questions do we have out there?
Can you go a little more in detail, the agent and the host?
Yeah, so when we look at agent, host, and environment, your host is going to be the person that's being exposed to the agent. So the agent's going to be a virus, bacteria, mold, things like that. And then that environment is going to also translate into where do they live? Are they living in poverty? Do they have access to healthcare? With COVID, our host was whoever got it. Our agent was going to be the virus, the actual COVID virus. And then the environment, we know that those that were in poverty filled communities had a higher rate. Does that help a little bit?
Yes,
Where do
ma'am.
we see homeless get their health care?
Free clinics?
The
Emergency
ER.
room? Yeah, the ER. We see it mostly in the ER, guys. Let's see. We didn't talk about negligence really and liability. Does anyone know about negligence and liability? So what would be an example of negligence?
Not providing care for someone who couldn't afford it.
Yeah, not providing care. Perfect. It's a perfect definition. So like if somebody's in the hospital and you don't answer the call light, it's negligence, right? Because we're not providing care like we should. What do we know about vapes?
They're poisonous to children.
Very good.
Especially.
Yepers. Our behavior risk factor surveys, those risk factor surveys is when we're screening people. So what are they exposed to? What's their genetic history? Things like that. Well, we know with alcohol, drug, tobacco use, what are some risk factors for this?
You mean like risk factors for using them, like heart disease because you drink too much, or you're
No, like risk factors. So the people that are gonna oftentimes be more likely candidates to use them.
or people, some kids, I guess, because peer pressure.
Yeah, well, we're gonna see, what we see is people who have violence in their lives. They're gonna try to cope with that with drug and alcohol. With childhood trauma, maybe like, we think about those kind of things. Addiction is genetic, so we know parents with addiction, and history of mental illness is gonna be our big ones. Mhm. What else? You have to give examples of host, environment, and agent. So you want to look at your outcomes, that wants to be a joint effort with the nurse and the patient, right? To see what they want to get out of it. And Medicare reimbursement needs to be what? Skilled nursing, right? Has skilled activity.
And the patient has to be homebound, correct?
Yeah. For that. And then for our Medicare and Medicaid, we know that you're homebound for Medicare, and Medicare is federally funded, Medicaid is federally funded, but Medicaid is state run. So please remember that state run is your Medicaid. And so that's why Medicaid in every state is called something different, okay? Because it's regulated by the state. Who's going to be more autonomous, the congregational parish nurse or the institutional? Who's going to work by
Congregation.
themselves more?
The parish nurse.
Yep, the congregational, not the institutional, because that's involving other people in their practice, right? Let's see, what else can we go over? All right, we know tobacco smoking is a huge cause of deaths than any other behavior in the US. Our fastest growing homeless population is who?
Single mothers.
You're close. Families with kids. We know in a rural community, what kind of diseases do we have more of?
Diabetes.
Well, that's an example of one. We have more chronic illness, right? Than acute, because they don't get as much care. Let's see here. We know that in our rural communities as well, they don't share as much information because.
Everybody knows each other.
Exactly. Let's see here. In our Mexican immigration population, we're going to make sure we're working with, calling them by name, being very social, pleasant towards them. We have our different types of studies that we went over. Our World Health Organization, remember what that does? It monitors our drug reactions, vaccines, research, and our diseases. What's the purpose of OSHA? Safe working conditions, remember, occupational safety and health. And then we reduce, we reuse, we recycle. That was in our reading for making sure. All right, any questions about what we've covered? No. All right, I would review your study guides. There's a lot of content on there as well. And if you have any questions, you can certainly reach out to me. I will send this recording to your professors, and I will also make sure that all this information is on a recording. Okay, you guys good? All righty. I'm gonna end our thing and stop recording. Have a good evening, everyone. Take care.
Thank you.
Thank you.
Bye-bye.
Mhm.